Before we jump into this video, I just wanted to give a little disclaimer for us all. I am a registered dietitian. I am not a certified eating disorder specialist. I do have a background in eating disorders, so I am not able to diagnose or treat eating disorders, and this is really just for educational purposes.
Yeah, I'm the same way. I'm a licensed and certified athletic trainer, but do not have any credentials in terms of medically diagnosing any mental health condition.
And this video is really just to educate and, speak on our experiences rather than, really treat or diagnose any of these diseases.
Yeah, if you feel like watching this video, you do have any of the conditions or signs or symptoms that we speak on, there is the National Eating Disorder Association does have a text line, so you can text NEDA to 741-741 to get more information.
And I will put all that information and additional resources in the description below.
There is a stigma, and typically it's a negative stigma. Nobody wants to talk about if you have an eating disorder or what causes you have to have an eating disorder. And unfortunately, our sport has a lot of the predictive factors that usually go into somebody developing an eating disorder. And so I think the awareness piece is a big thing. And so parents, coaches, athletes themselves, they understand or they are become aware of these are behaviors to look out for. These are things that kind of put you on that path, and both behaviors of an athlete and a coach that perpetuate that risk, I think, is important to touch on.
Hi everyone, welcome back to my YouTube channel. I'm Ashley, the Cheer Nutritionist, and I'm so excited to be here today talking with Dr. Allison Smith about eating disorders for National Eating Disorders Awareness Week. So Allie, you can jump in and introduce yourself.
Yeah, thank you so much for having me. So I'm Dr. Ashley Smith. I am a certified and licensed athletic trainer. I was a cheerleader for about 10 years, went to college and have an undergraduate degree in athletic training, have a master's degree in allied health, and then have an exercise science PhD from the University of South Carolina. And so currently I do research within the world of eating disorders, specifically in cheerleaders, and practice clinically as an athletic trainer at a small Division III school in Ohio.
That's awesome. We have been collaborating for a good bit of time now. So we know each other pretty well, and I'm so excited for my audience to finally get to know the brain behind all my posts and basically behind the operation from the, eating disorder awareness, disordered eating side of things. I worked under you for a little while and I had a great experience. You really inspired me to start the Cheer Nutritionist, and I can never thank you enough for that. But I just wanted to give everyone a brief little introduction of what NEDA Week is, what we call it, National Eating Disorders Awareness Week is. So basically it's the week of February 27th to March 5th. And it's an annual campaign to educate the public about the realities of eating disorders and to provide some support for the individuals and families that may be affected by eating disorders. I think it's so important to introduce this topic to the cheer community because both of us, we know that these things are happening and we just need
Absolutely.
to have a conversation about it. So I'm really glad to be doing that today.
Yeah, I'm excited as well.
Yeah. So let's really just dive right in. I know you have a lot to talk about when it comes to, the studies you've done, things like what to look out for coaches, athletes, parents. And I want to touch a little bit on each of the eating disorders, what they look like, talk some practical tips from there. Sound good?
Yeah.
Great. So let's dive in.
Yeah, so what kind of started my research journey in the sport of cheer? Like I said, I was a cheerleader. I personally didn't suffer from a formal diagnosable eating disorder, but I was injured a lot, and I suffered from what I believe was low energy availability for the large part of my career as a competitive cheerleader. And so as I was looking into continuing on my education and my clinical practice, what drew me to South Carolina is that the research group there, specifically my mentor, Dr. Tony Torres-McGahee, at the time had the only cheer study with competitive cheerleaders. So they looked at eating disorder risk and body image dissatisfaction in 2012 with cheerleaders, college age cheerleaders. And so that really sparked my interest. That's what kind of brought me to South Carolina. And then there, going through my curriculum, having to kind of decide on a path or a research line, I was really adamant that, like you said, we both know that this is something that unfortunately is prominent in our sport that we both love, but I wanted it to be a light of, it's not bad, but we can do things better, right? And so part of my dissertation, or the big studies that I did at my time there, was I surveyed about 500 athletes, both a mix of adolescents, or kind of our all-star community of cheerleaders, those under the age of 18, as well as college age cheerleaders. So we had about 500 and some athletes take our survey, and we did an eating disorder risk. So nobody on our research team is a nutritionist, a psychologist, so we didn't want to diagnose anybody, which is, I think, an important thing to remember when you're reading a lot of the literature, is that unless they have those credentials, that we shouldn't be diagnosing people. But we found about 33% of cheerleaders at any age are at risk for an eating disorder. And that's been pretty consistent from all the way back in 2012. So over the last decade, our studies were about 10 years apart from that original one to now, and adding in the all-star kind of component didn't really change that risk. The other thing that we looked at was body image dissatisfaction. So one of my big kind of pushes of my research is the midriff uniforms. Why those are necessary, why there's such a big draw to them in our sport, I don't really understand. But we asked athletes how they felt in their uniforms, both in a uniform that covered their stomach versus one that did not. And we asked them 2 specific questions: their perceived body image, so how they felt they looked, and then their desired, what they want to look in both of those uniform types. And what we saw is consistent again with that back in 2012, is that people want to be smaller in a more revealing uniform. And so when you couple that with this already at risk just by being in the sport of an eating disorder, that makes that percentage, go up a little bit. Right. And so then my second study, we looked at the female athlete triad, which is a kind of a holistic approach to female athletes, of looking at their energy availability, which can happen with or without an eating disorder. It looks at their bone health and their menstrual cycle health. And so I looked at the cheerleaders at South Carolina. That was, I was collecting during COVID, so I was kind of limited to who I could go and do intake on. But we looked at, we had about 20 athletes that did all the parts of our study, and they all were at risk for low energy availability, and a high percentage were at risk for an eating disorder as well. Again, we didn't risk for eating disorder because I'm not qualified to diagnose anybody. And so going from that, currently at my current position, the research is kind of an extra thing I'm doing. And so working with you and trying to get some more of that stuff going with a larger population, and just this awareness piece. I think obviously when we talk about eating disorders and we talk about Eating Disorder Awareness Week, like the awareness piece is what's important. And that's kind of what's driving me, is that there is a stigma, and typically it's a negative stigma. Nobody wants to talk about if you have an eating disorder or what causes you have to have an eating disorder. And unfortunately, our sport has a lot of the predictive factors that usually go into somebody developing an eating disorder. And so I think the awareness piece is a big thing. And so parents, coaches, athletes themselves, they understand, or they are become aware of, these are behaviors to look out for. These are things that kind of put you on that path, and both behaviors of an athlete and a coach that perpetuate that risk, I think, is important to touch on.
100%. I mean, there's so much we could unpack from what you just said, but I do want to let everyone know I did have a bit of a different experience than Allie did. Like she said, she was never diagnosed with an eating disorder. I never was either, but I definitely did have, looking back, I should have been diagnosed with an eating disorder, and definitely had disordered eating, behaviors. But it just shows how everyone, like you said, 33%, that's a high percentage of all cheerleaders. And then the low energy availability study, having 100% of them not having enough energy to being able to perform, like, it just shows how widespread this is. And I think you said it best, it's the awareness. We don't know it's going on, and really the people who are, I guess, in charge aren't talking about it. It's not normalized, and it makes these things go unnoticed and are secret, like almost secretive. I know mine was secretive. I never talked about it until a year ago.
Yep. I think the big thing too is that kind of the awareness piece is that because our sport is still kind of, it's not new to us because it's been pretty much our whole life, but in the sporting world, it just made it into the Olympics, and so the world is starting to see this kind of new phase of competitive cheerleading that we know and love. And so with that, there's not a lot of research on it. I think if you do, I mean, last week when I did that quick search, there's my 2 studies, my mentor study, and then everything else is from like the 80s or 90s, much later, that's not really relevant anymore. Right. And so there is just a complete misconception of how athletic this sport is and the athletic demands and therefore the energy needs to perform that at a high level. And so while this is an aesthetic sport, that in itself is a risk factor. So for parents, coaches, anybody that's watching your channel these days, being in an aesthetic sport, so a sport that's based on everybody looking the same, everybody, doing very high flying and acrobatic stunts, that it costs a lot of energy for your body to be able to do that. And so you put that in one hand of, we need a lot of energy, but we want to look really good and small doing it. And the scales, are not the same. And so that was one thing that I was really, kind of shocked, but kind of also expected in a sense in my study. So I did a nutritional needs assessment as well. So I had those athletes at South Carolina track their food intake over the week that we studied them. And so to your point of them, they just don't know what to eat and they don't know how much they should be eating to go do a 2-hour practice. And being able to compare, I mean, both of us were pretty high level at our sport, that comparing that to a 2-hour soccer practice, like even cheerleaders don't know how to equate that. Like they don't realize that tumbling for, 25 minutes, stunting, going full out for an hour, like that takes so much energy that we just need more people to be able to study. That way we can get some of these normative data to tell people to go, make a whole nother video and say, if you're at this level of cheerleading and you're doing this many practices, this is how many calories you should be eating. And so that's one thing I really want to draw the awareness to, is like, people are just unaware of how athletic this sport is.
100%. And actually, that cheer show that came out, I actually rewatched it recently. Yeah. Just to see if there was anything, else in there that I could find to talk about. And from the first episode of the first season, they were doing weigh-ins. Yep. And you never really saw them eating at practice. In the second season, they talked about a watermelon diet. It was so clear that cheerleaders just don't know the amount of energy that, like you said, that it takes to be at that high level. And, yes, injuries are naturally occurring in sports, especially in cheerleading. But a lot of them are preventable. I know I had a career-ending injury. I tore my labrum in my hip and needed surgery on it. And probably could have been avoided if I wasn't in that state of low energy availability. But I would love to hear a little bit more about like signs to look out for. What do we need to know as coaches, athletes, even teammates? What do we need to know to be able to really grasp these things and get them under control?
Yeah, so a lot of my recommendations are from my research background, but some of them kind of overflow into kind of my anecdotal experience, being a cheerleader, being around cheerleaders. And so I think the first one is for parents and coaches to look at kind of the person as a whole. And if there's a very quick weight loss drop, obviously the recommendations vary based on kind of where you get your information from, but generally it's about 2 pounds a week is what we should being a healthy weight loss. Anything more than that is not maintainable, right? And so I think if there's a drastic change in their overall weight in a short amount of time, that's a red flag for parents and coaches and teammates. The big one from my research is constant and consistent injuries or sicknesses. So do you have that athlete that always is getting hurt? And it's not from, freak accidents within our sport. They are constantly having muscle strains or ligament sprains, or, those things are taking a lot longer than kind of the norm to heal. The kid that always has strep throat 4 or 5 times a year, the kid that always is, has a cold and just is kind of sickly. kids, adolescents, college age cheerleaders shouldn't be sick all the time.
Right.
That is a red flag that your body is depleted of the energy it needs to fight off those sicknesses. And so that's kind of where the low energy availability comes in. Their body doesn't have enough energy because we're not fueling it properly, or we're working too much at practice, over exerting ourselves for what we're fueling ourselves. And then the big ones that kind of fit into kind of the what people think of eating disorders, the restrictive dieting, the cutting out of certain food groups, or the not eating any sugar or any carbs, or the laxative use, the diet pills. Those were big things we saw in our college population when we did one of our studies. Is the amount of laxative use is pretty high. I don't know the number right off the top of my head, but I want to say it was between 11 and 15% of our respondents said that they had used laxatives as a means to control their weight, which gives them a short-term fix. They lose weight quickly, but there is an addictive response to those types of medications, and they have really long-term health consequences.
Yeah. I mean, I can definitely speak to that one. My video about my disordered eating history is coming out later this week. But I did abuse laxatives for a while, and I still to this day have stomach issues that just never healed. And probably I've tried, but that kind of thing lasts a lifetime. And you're so right about the diet pills. Like, those are thrown around nonstop, and it's just, they think it's that quick fix, like you said, and it might be that quick fix, but they don't realize the long-term effects.
Mm-hmm. The other big thing that I know that we've talked a lot about too is not so much a red flag, but more of a behavior change that I really want to highlight as the awareness piece is public uniform try-ons and weigh-ins. There's just no reason for it. And I understand that some coaches might think like, well, I want to track their weight so I can tell if there's these weight changes. And what we've seen in the literature and in the research is that, one, there's no psychological, like, it does psychological damage to our athletes. They don't see it as they're tracking me to be healthy. They're tracking me because if I gain a pound or two, I'm going to be off the team.
Yep.
And what's, unfortunate about our sport right now is that it's that next man in line mentality. Like, you can't do this, you can't perform. We've got alternates. We can put somebody else in and we're going to win with or without you. And so we've talked a lot about that, where it's, you do whatever you can. And then when you do potentially lose a few pounds, or you get a new skill because you lost weight, that's sometimes praised. And so I think coaches, that's one of my advice to coaches is not to not praise your athletes for doing well or for losing weight or whatever it may be, but be cognizant of the comments that you're making or reactions to comments that you're making. I think there's no place in our sport right now where we need to be making public comments about weight. We don't need to be weighing in front of people. We don't need to be trying on uniforms, which I know we both have very, good views on that. Experiences from that. But I just think parents need to be cognizant of that too, of, how is your athlete acting after practice? Are they always down? Are they not wanting to go to practice? Are they not wanting to do, certain things with friends because it involves food? Those are all red flags of just to start the conversation of how's it going?
Yeah. Again, great points. I think the weighing from a coach, it's also like that authority figure that, some people have a great relationship with their coaches, like they're friends, and then they're taking this role of doctor kind of.
Yeah, 100%.
It's just not necessary, especially when your athletes are, getting regular physicals every year. Like, that's the doctor's job. And also, we know that, BMI is not a good indicator of health. It was made in the 1800s by an old white man and tested on old white men. Yeah. So it doesn't really apply to us, right? It just doesn't. And the same thing goes for uniforms. I have experienced this. It just breeds a culture of comparison. And we all know when you're starting to compare it against people, that's also some type of eating disorder risk behavior because you're going for that perfectionism. Perfectionism is a major risk factor for eating disorders. Some other things that I was just thinking of when you were talking were, yes, coaches, you can make comments on how good they're doing with their tumbling skills or how good their stunts look in the air, but there's no really reason to comment on someone's body size. There's no reason to comment on really their aesthetic appearance at all, in my opinion, because it's like, why are we worried about how someone looks? We should be more concerned about how they feel and comment on their personality, how much you love them as an athlete. Like that is going to go a lot further and be a lot better for your athletes than, you know, the latter. Something also I experienced as an athlete was the conversations that go on during practice. I think this is like a big one that coaches especially need to be, you know, keeping their ears wide open for. Saying, if you hear athletes saying things like, oh, I barely ate today, or I only had Starbucks before practice, or I don't want to wear a sports bra because I feel fat today. Like these are all trigger words that we should be listening out for. And when you do hear them, either have a conversation, talk to their athletic trainer, talk to their doctor, talk to their parents if it's a high school level athlete. These are things that we need to be looking out for. And then as parents, some things that also came to mind is like very secretive eating. So like if you find wrappers in their room or hidden food in their room, or they're not eating at family meals anymore, they want to be more secluded in their room to eat, or wherever it may be, not eating in front of people. That's a big one. And also, you know, only wearing baggy clothes and trying to hide their appearance as much as possible, hats, scarves, you know, these are all major things to look out for. It's just crazy that the conversation isn't there yet, in my opinion. Because it leaves these athletes with like nowhere to go, right? They feel like they don't have the support. They feel like they have no one to talk to. And that's probably the worst thing that can happen when someone's in this state.
Right. And I think, again, for the awareness piece, coaches, gym owners, parents, you know, if someone were to get hurt at the gym, they send them to the doctor, right? And I think with the way that the world is going and kind of the mental health, you know, eating disorders are a mental health disorder, that we need to have some resources within, like, that's the responsibility of a coach or a gym owner, of having that kind of looking in your area of like, okay, if we know that somebody's struggling with this is a number, a website, a counselor, a psychologist that I can send kind of in that path, because that's out of the scope of a coach's or gym owner's responsibility or kind of scope of practice. They shouldn't be managing those, but it is their responsibility to be able to give the resources, in my opinion, of, you know, you would give a sprained ankle to a doctor, an eating disorder needs to go see a nutritionist, a psychologist, and have a multidisciplinary team.
100%. And it's just unfortunate that the resources aren't really there for cheerleaders yet. I mean, that's what kind of inspired me to do what I'm doing, because I want to educate. I want them to have someone to go to for support during these things. Obviously, I can't treat disorders, but I can refer out. I have those connections to be able to refer out. Awareness is just the biggest piece of this, and having those things in place. Another thing that I know we've talked about a lot is coaches' education. There is no formal education for nutrition. There isn't formal education for injury support or anything that like you treat either. And a lot of all-star gyms don't have athletic trainers on staff, if any. And, you know, we need to fill that gap somehow, some way, whether some type of formal training or some education across the board. Like it needs to be there.
Yeah. And that's what I think so great about your program, is that it's the way you have set up the Cheer Nutritionist and your programming, is that not only do you give all the information on your social media platforms and now your YouTube channel, but like your program is individualized. You know, you do the check-ins with the coaches to kind of get the culture or the background of the gym, but then you meet, either you try to go in person or you're accessible through Zoom. And I know the few that I sat in on, just the wealth of information in like an hour Zoom session that these kids or athletes are probably getting a portion of through their public school education about nutrition, but for them to, the way you frame it of, you're an athlete, a football player at a college goes to a nutritionist or goes to training tables or goes to, fuels their body as a machine. And that's my big push of the awareness of is cheerleaders are doing just as much in this sport the way it is today as a soccer player, as a track runner, as a football player, as a basketball player. And we need to start treating our bodies. And the other thing I think that is, we're seeing this kind of growth of our sport, going into the Olympics. But what we're also seeing is that we're kind of in this new generation of most of the coaches and gym owners were cheerleaders 10, 20 years ago, right? And so we're fighting this cultural kind of trying to reshape this culture, which I think people are for, but to your point, they just don't have the resources. So it's kind of like, you don't want to ask the question if you don't know how to fix it.
Right.
And so that's what, what you're doing is amazing, because you're giving people a lot of really good information that a lot of people will read and be like, I never knew that. But then but it's so applicable to our sport.
Yeah, I think that's such a good point, that it has to be a culture change. I mean, like you said, a lot of coaches were former athletes. The way that cheerleading was even 10 years ago when we were cheering, it's a lot different now. Like, routines are jam-packed. Like, everyone's doing everything most of the time. Like, it's very, very athletic. And with that change in the culture, has to be the shift in the culture for the coaches and the way they teach. And just like you said earlier, this is a mental health issue, right? And just like we're making changes to help athlete health and mental health, we need to do the same for this kind of realm of nutrition and injury prevention and, disordered eating. Yeah. And something I also wanted to touch on a little bit was the difference between disordered eating and eating disorders. So obviously we've been throwing both terms around a little bit. Can you speak a little bit to the difference between the two?
Yeah. So like I mentioned, eating disorders, which I think we're going to talk about the specific kind of terms for those, are diagnosable. They're in the DSM-5, which is kind of the psychosocial or the counselor's kind of handbook of, they are diagnosable. There's a code for them to be billed for the treatment of those things. And so that was revised, I believe, within the last 5 years. So the DSM-5 is the newest version, but those are mental health disorders. They have very specific criteria. They are time-based. Things have to be happening or occurring for X amount of days or weeks. And so disordered eating is kind of a catch-all term for behaviors or symptoms that don't meet that strict requirement or strict kind of protocol based for the DSM-5. And so disordered eating usually precedes eating disorder. So disordered eating is kind of what gets people into the behaviors, the pathogenic behaviors, the laxative use, the restrictive eating. And then once it has made the person have specific feelings or behaviors for X amount of time, and it can be documented that it's been happening for this amount of time, then they transition over into the eating disorder diagnosis. It all kind of boils down to an insurance term, things that can be billed for insurances to cover the treatment or the diagnosis of. But it is a good point to make that a lot of people kind of use them interchangeably, but they are very two distinctive, different things.
Right. And I guess along that topic, I want to jump in and kind of explain what is an eating disorder, what the eating disorders are. So the one that is probably most popular, or like the typical eating disorder, is anorexia nervosa. This is, restriction of energy intake leading to a significantly low body weight, intense fear of gaining weight or becoming fat, and it's a disturbance in the way one's body or shape is perceived. So how they see themselves is a lot different than what they actually look. And this is actually, even further split into two categories of restricting type and binge eating and purging type. And like you said,
those two are what helps with the diagnosis. So this is, like you mentioned, this is an eating disorder. This would fall under the DSM-5, and those two types that you're about to talk about helps further diagnose to then help a bigger range of people. And so the DSM-5 designates those two types as they have to have these behaviors for at least 3 months.
yes. So it's time bound. And that's what we mean by it's specific, it's diagnosable and in that criteria. So there's the restricting type and the binge eating and purging type. So the restricting type is no episodes of binge eating or purging. And that's different from the other one, which does have the recurrent episodes of binge eating and purging behaviors. So purging behaviors include laxative use, diuretics, enemas, all the things to get rid of that food.
Yeah.
And they're also,
some of the signs and symptoms for those.
Yes, of course.
Yeah, so these ones are like Ashley said, this is kind of the forefront of when you say eating disorders, people typically immediately say anorexia nervosa. And so generally the stigma is these are the really skinny, kind of, you can see their bones, they look very, very ill or frail. But some general kind of symptoms, if you will, they're going to have like really dry, ashy skin. They're going to start losing their hair because, again, they're really restricting how much energy they're putting in their body, or they're getting rid of it through the binge eating. And so they're going to have low energy availability. So their body stops producing certain hormones. So really dry skin, their hair is going to be brittle and potentially falling out. And then also they're going to have some of the internal symptoms, I like to say, of they're not going to have their period, they're not going to have a regular menstrual cycle, and they're going to have to start seeing some complications with the reproductive system from that.
Yeah. So, all things to look out for. Obviously, this is full blown, diagnosable eating disorder. So just to keep in mind. Then the next one, which is also a more well-known one, is bulimia nervosa, which is recurrent episodes of binge eating at least once a week for 3 months, and then recurrent inappropriate compensatory behaviors to prevent the weight gain, which again is those purging type behaviors, self-induced vomiting, misuse of laxatives, diuretics, any other diet pills, fasting, and excessive exercise is actually included in this one as well. And again, this is time bound. It occurs on average at least once a week for 3 months. And there is also, along with this one, that disturbance in the way one's body is perceived.
Mm-hmm. Yeah, these ones have a little bit more. So like anorexia is typically the thought of like the really skinny, frail individual. Bulimia nervosa has some physical signs as well. So these are the ones where because there's a purging behavior where typically it's self-induced vomiting or laxative use, constantly going to the bathroom after meals or after episodes of eating, where you see these on TV shows and movies a lot, where the person will eat kind of normally and then they'll excuse themselves to the bathroom and be in the bathroom for a longer than normal period. Other physical signs that you'll see is actually on their hands, kind of on their fingers, they'll get calluses from actually creating a self-induced vomiting. The other thing is their teeth. From that self-induced vomiting, they'll get some teeth decay or some teeth malfunction that's not normal for someone of their age, is a pretty prominent physical sign.
Good to know. Good to know. And then the next diagnosable eating disorder is binge eating disorder. So this is, the recurrent episodes of binge eating. And that's characterized by eating a large volume of food that is definitely larger than what most individuals would eat. I want to stress this because some people perceive what they're eating to be a large amount, but this is beyond what some may think is large. And this is in a discrete period of time. So like within a 2-hour period, they're eating a lot of food, and they have a sense of lack of control. Like they can't stop this. They can't control how much or what they're eating. And, this could be associated with eating more rapidly than normal, feeling uncomfortably full, eating a large amount of food when not actually hungry, eating alone because they're embarrassed, and feeling disgusted by themselves. These are all some of the characteristics that you may see. These binge eating episodes happen at least once a week for 3 months is the kind of timestamp on this. And this is actually not associated with the compensatory behaviors that we talked about. So there's no purging of the food that they're eating in these large amounts. Mm-hmm. And this one has been, gaining some popularity, and it is a diagnosable eating disorder.
Yeah, so these are like the people that you see on TV or in movies that get up in the middle of the night and like go rummage through the pantry and are eating like everything in the pantry, or like you said, the like uncontrollable, like I'm full, but I need to eat everything on my plate, or those kinds of behaviors.
Yeah. And then from there's this whole list of what they call OSFED, or other specified feeding and eating disorders. And this one I actually can speak to because I was, I guess, in between of like atypical anorexia nervosa and bulimia nervosa of low frequency or limited duration.
So this category was an addition to the DSM-5 because what clinical psychologists and counselors were seeing when they were doing treatment for eating disorders, but with the old version, was that they weren't meeting any of these stringent characteristics of the old diagnostic criteria. Right. And so this category was kind of a way, kind of a benchmark between no diagnosis or disordered eating and these full-blown, the 3 that we just mentioned. So this is kind of a stepping stone where we call them in our research subclinical kind of disorders, where they're on the road to being a full-blown eating disorder. They need treatment and they need it to be covered by insurance. And so they made this group and kind of made those 3 different categories to help people get treatment earlier on in their diagnosis.
Yeah. So really atypical anorexia is meeting some of the criteria of normal anorexia nervosa, but their weight can be within a normal or even above normal range. So they still have the behaviors, but their weight doesn't reflect that. With bulimia, it's the same type of thing, but the timestamp is not as frequent, or it's less than 3 months or more than it's not within those constraints. Then there's also the binge eating disorder, also low frequency or limited duration. And again, this is for less than 3 months or less than once a week with those behaviors. There's also purging disorder, which is recurrent purging behavior to influence their weight, but it's in the absence of binge eating. And then night eating syndrome is recurrent episodes of night eating that are manifested by actually awakening from your sleep to eat. It's not just eating before bed. It's either awaking from sleep to eat and consuming excessive food during that time. And then there is one more eating disorder that's ARFID, which is avoidant restrictive food intake disorder. This one differs from the other eating disorders, I think, because there's no disturbance in the way one sees their body. It is characterized by persistent failure to meet their nutritional needs and energy needs, but usually due to some type of sensory characteristics. So they have a lack of interest in eating food in general, or because of some types of characteristics. So they won't eat white foods, or they won't eat foods of a certain texture, and it leads to this nutritional deficiency and significant weight loss.
Yeah, these are like your picky eaters, and they don't know, or they can't, articulate why they're picky. So, we see it a lot in our younger age group of they only eat chicken nuggets, or they'll only do this, or they only eat this food group, or they don't like, green beans or whatever. And so, to your point though, it leads to a nutritional deficit. They only eat chicken nuggets for every meal, and so they're missing out on, nutrients, minerals, all those things from other food groups. The other quick point I just remembered when you said that about ARFED is in the DSM-5, all of these disorders are characterized under the feeding and eating disorder category. So we just covered the eating disorder ones today. There are a few other ones that lead to feeding in this terms of like you're ingesting something and have a disturbance with that. But
Yes.
These are the typical ones that we see kind of clinical in the sports world.
Yeah. So we just wanted to touch on these, educate a little bit, kind of make that distinction between these full-blown eating disorders versus just disordered eating habits. So there is that difference, and I hope we made that clear for you all.
Yeah, and I think we've talked about this too a couple times today of neither one of our educational backgrounds are able to diagnose these things. Obviously, we are well versed and can speak to what they look like and potentially have personal experience with them, but we are not ever going to be able to diagnose somebody with any of these mental health disorders. It's just not within our education scope of practice or the licensures that either one of us currently have.
100%. So this was amazing, Allie. Thank you so much for being here and speaking on these topics with me. I think this was really informative, and it will be great for my audience to really listen and learn about these things.
Yeah, thanks for having me. I'm excited to talk about this.
Of course. And for all you viewers, if you like this video and want to see some more, don't forget to subscribe to my channel, turn your notifications on so you know when I post. Like this video and leave your comments and questions down below. I love getting questions from you guys, and I'm sure you probably have a lot of questions on this topic. So drop them in the comments below, or you can always reach out to me on Instagram or email. All my links will be down below. And Allie, I will post your stuff as well down on the bottom, so that way they can find you and connect with you as well. But thank you so much for being here.
Thank you.